We're talking about the fatal injuries that can occur in a child, and if they are provided by the caregivers of the child, then they are basically proving as the battered baby syndrome, or it's also regarded as the CAFE syndrome. All of these phenomena are basically referring to a child that is being subjected to constant abuse or constant domestic violence. That is basically pointing out, these are the pointers towards such an abuse. So, as an investigator, as a forensic practitioner, one should be aware of such kind of abuse. What are the different type of injuries that can occur in such case of the fatal child abuse? Now, the head and the visceral injuries is one of the phenomena that can occur whenever we are talking about the different modes of the abuse that one can relate to in cases of the child abuse. Damage to the eyes, ears, and mouth is another phenomena that has to be looked for, and burn, bite marks, and other injuries. So sometimes the children are subjected to high temperatures, and that can also lead to a fatal child abuse. Bite marks have to be looked for. Other types of fracture injuries or other type of injuries can also be related to such kind of a child abuse. Head injuries in child abuse, so subdural hemorrhages, cerebral edema, and then we can have STH. All of these phenomena are basically referring towards the head injuries that can occur in cases of child abuse, or whenever we have the frontal impacts of the head with the floor, or side bangs with the walls as well. Now, the autopsy indications that can basically refer to such kind of an abuse are the heavy brain, of course. Then we can have flattened gyri in a lot of cases. Obliterated sulci are also present in these cases, and then we can have the slit-like ventricles. They are found due to increased pressure, due to the blood around the brain that can basically prove to cause flattening of the ventricles and flattening of the sulci and the gyri of the brain as well. The cerebral contusions or lacerations are looked for, and if they are found, they are basically indicating towards the head injuries. The visceral injury in the child abuse is to be notified. The damage confined to the abdomen is another phenomena that has to be looked for. Rupture of an abdominal viscus. As you can see over here, this diagram is basically referring towards a lacerated liver. We have a lacerated pancreas over here. And we have the hematomas that are found, intestinal hematomas that are also indicative of child abuse. Deep tears in either lobes of the liver are found. Hemoperitoneum is one of the indicator in such a case. Gut wall may be damaged in these cases, and ischemic and necrotic changes are found and they're looked for. We have peritonitis in these cases. Jejunum is basically looked for. Any signs of laceration, of mesentery, hemorrhage into the peritoneal cavity, even that has to be looked for in such cases of the child abuse. Black eyes, whenever we are concentrating on the eyes, mouth, and ear of a child that has been subjected to abuse, we have to look for the black eyes phenomena. The scleral or the conjunctival hemorrhages have to be looked for. Damage to the interior of the globe, less apparent at the autopsy. The internal damage to the eyes, that is also to be looked for and emphasized upon if it is found in such a case. Injury to the external ear is quite frequent due to the fact that the child can be subjected to the constant slapping phenomena that is going to basically damage the external ear in such cases. Pinna are bruised or lacerated in these cases. Damage to the internal ear is diagnosed clinically in such a case, and the hemorrhages into the petrous temporal bone. So such fractures and such hemorrhages have to be looked for if we are suspecting head injuries in a particular case. Now, damage to the torn labial frenum. So if you're suspecting an injury to the mouth, we have a swollen lip or we have a bruised lip, we will basically examine even the internal surfaces of the mouth, and that will basically point out towards the labia frenum if it is torn or if it is injured in a lot of cases. Damage to the lips is also observed if it is swelling, if it is bruised, or external lacerations are found. Inner mucosa is sometimes bruised in a lot of cases. Teeth are total avulsion can be found from the sockets. There can be loosening of the teeth and there can be breakage of the teeth observed in such a case. So burns in child abuse are quite common. A lot of time, a lot of incidents. Basically, the kid was punished, and he was basically held in a bathtub with high temperatures of water. So that basically can lead to scalds in a lot of cases, or even rods. Basically, the heated rods can be implied in a lot of cases. That will basically cause the dry burns in such a case. We can have moist burns, dry burns can be found in a lot of cases, or exceptionally, electrical injuries can even be found at the child abuse cases. Cigarette burns are quite circular in their shape, and they are sometimes triangular. Shape and size usually indicate the nature of burn in these cases. Bite marks, if they're found, they have to be looked for anywhere on the child's body. It can basically indicate towards such a marking. Individual teeth marks are basically sometimes found in a lot of cases. Abrasions or bruises are found in a lot of cases. We have the confluent petechiae. So basically these bruising is going to confluence together, and that is basically going to form the petechial hemorrhages in such a case. Measure the size of the dental arch. So the dental arch, size of the dental arch is basically measured, and if you're suspecting a particular person, the size can be matched to that person, and that is basically going to indicate who was involved in the abuse cases. Now, the other injuries that can basically refer towards such kind of an abuse in such a case, we can have basically the face, the cheek, or the side of the face can be involved if bruising or the finger marks are found in such cases. Then we can have black eyes in a lot of cases. Then the ears can be basically we can have pinch marks, or we can have slap marks, or the bruising phenomena is found in a lot of cases. And then we have the skull. Skull can be involved, and we have to look for if there are some sort of fractures. In a particular case, bruising can be found, bleeding can be found. Now, these skull images we can have radiological imaging in a lot of cases. That is basically point out towards the skull fractures in these cases. Then the mouth, if we can have the torn frenulum in such a case, and then the shoulders that are basically going to point out towards the bruising phenomena, grasp marks, if a lot of pressure has been applied in such cases. Buttocks or thighs are involved in a lot of cases, especially the genitals can be involved if the child is sexually abused as well. Then the buttocks or the inner aspects of the thighs can be involved in such cases. Knees, we can have grasp marks on knees as well. So basically the hair are pulled out in clumps. It's basically an appellation phenomena. These signs have to be looked for in these cases. Then we can have pseudo alopecia on the scalp. It's basically going to point out towards the pulling out of the hair, or just putting pressures on the scalp of the child. Fingers are broken by the hyperextension. It's again other traumatic condition for the child that can prove to be fatal in a lot of cases. Then we have the fingertips that are crushed in a lot of cases. There are patent marks from the straps or the ropes, and pinch marks or the twitching marks are present on the ears as well. So in this section, basically, we dealt with the different kind of fatal injuries that we can observe in any case of fatal child abuse that we are particularly referring to. That is the end to this section. Thank you for watching sqadia.com.